A very good morning, everybody. Today we will be dealing with the fibula. Now, the fibula is the lateral bone of the leg and it is long and cylindrical. As it does not come in contact with, as it does not have any role in transmission of body weight, therefore this bone is thin and cylindrical. Like any other long bone, it has an upper end, shaft, and a lower end. Okay? Now, both the ends are expanded, but its upper end is expanded and on all sides, and the upper end constitutes what is known as the head of the fibula. On the superior surface of the head, when you see, on this superior aspect of the head, there is an articular facet, and this articular facet articulates with the fibular facet on the lateral condyle of the tibia. The lower end of the fibula, as you can see here, is flattened from side to side, and its lateral surface has a non-articular area that is known, this projects downwards and is known as the lateral malleolus. The medial surface of this lateral malleolus, or we can say the medial surface of the lower end, has a triangular articular facet in its upper part and a depression in the lower part. This depression is known as the malleolar fossa. Now, for the side determination of the bone, hold the bone in such a way that its head looks upwards. The malleolar fossa lies downwards and medially, and this subcutaneous area lies laterally. Basically, hold it like a pen, like this. Put your thumb in this malleolar fossa में thumb रखो और उसको ऐसे पकड़ो. ये सरफेस, ये सबक्यूटेनियस सरफेस, जो लेटरल मेल्यूलस का लेटरल सरफेस लेटरली होनी चाहिए. ऑब्वियसली ये लेटरल साइड पे, तो मेल्यूलर ये लेटरल मेल्यूलस जिस साइड को फेस करेगा उस साइड की ये बोन है. देयरफॉर ये राइट साइड की बोन है. ओके, सो दोबारा लॉन्ग सिलेंड्रिकल बोन है, लेटरल साइड में है, अपर एंड है, शाफ्ट है, लोअर एंड है. अपर एंड एक्सपैंडेड है, उसको हेड कहते हैं. उसके सुपीरियर सरफेस पे आर्टिकुलर फेसेट है. लोअर एंड पे हमारे पास प्रोजेक्शन है डाउनवर्ड्स लेटरली, जिसको हम लेटरल मेल्यूलस कहते हैं. उसके मीडियल सरफेस पे ऊपर एक आर्टिकुलर फेसेट है, नीचे एक डिप्रेशन है जिसको हम मेल्यूलर फोसा कहते हैं. इस मेल्यूलर फोसा में थंब रख के लेटरल मेल्यूलस को लेटरली रखो, तो ये लेटरल जिस साइड की बोन है उस साइड से हमारा लेटरल मेल्यूलस फेस करेगा. तो ये राइट साइड की बोन है. ओके, नाउ coming to the features of this bone. So, like any other long bone, I said it has a upper end, a shaft, and a lower end. Talking about the head, as you can see here, the head is expanded on all sides, and it overhangs the shaft, especially on this lateral. I will be zooming on the head part here. On the lateral side and posteriorly, you can see it overhangs it. Okay, ये anterior aspect head का ये है. ठीक है, तो ऐसे रखेंगे हम लोग बोन को. होल्ड इट लाइक दिस. दिस इज, अगर आप लोग देख रहे हो, दिस इज द एनाटॉमिकल पोजीशन राइट साइड की बोन की. ठीक है, अब अगर हेड देखोगे, हेड एंड ये हम लोग इंटीरियर व्यू कर रहे हैं. सो इट ओवरहैंग्स फ्रॉम द लेटरल साइड एज वेल एज पोस्टीरियरली. इट ओवरहैंग्स द शाफ्ट. सुपीरियरली आई सेड दैट द हेड हैज एन आर्टिकुलर फेसेट which articulates with the tibia, lateral condyle of the tibia. Okay, as you can see here, from the posterior lateral aspect of the head, a bony process projects upwards. This bony process is known as the styloid process of the fibula. The head of the fibula as whole forms a bony prominence that can be felt on the lateral aspect of the knee joint. Okay, now talking about the attachments on the upper end, if you look at the attachments on the upper end of the on the head of the fibula, we see that the head of the fibula gives attachment to the following structures. Anteriorly, if we see here, we have origin of the extensor digitorum longus muscle. Posteriorly, the head gives origin to the soleus muscle. Laterally, it gives insertion to some of the fibers here of the biceps femoris muscle. Okay, and origin to the peroneus longus muscle, and there is attachment of the fibular collateral ligament of the knee joint again. So when we look at the head of the head of the fibula anteriorly gives attachment here. This is anterior aspect. So on the anterior aspect, it gives origin to the extensor digitorum longus muscle. On the posterior surface, it gives origin to the soleus muscle. Laterally, it gives insertion to some of the fibers of the biceps femoris muscle and origin to the peroneus longus muscle, and it gives attachment to the fibular collateral ligament of the knee joint. Okay. The margins of the articular facet gives attachment to the capsular ligament here of the superior tibiofibular joint. Clear? So, anterior aspect of the head पे extensor digitorum longus, posteriorly soleus, laterally biceps femoris का insertion और fibular collateral ligament. इतना आपको याद रहना चाहिए. ये complete करता है आपका head. Okay? Now, talking about the lower end of the fibula. If you look at the lower end of the fibula, as I've already said, that lower end में क्या features होते हैं? जब हम देखते हैं lower end में एक projection laterally है, that is known as the lateral malleolus. Okay, so the lower end of the fibula projects downwards below the level of the lower end of tibia and is known as the lateral malleolus. It consists of, when we see, it has a lateral surface here, it has a medial surface here, lateral surface, medial surface, and it has a posterior surface. Okay, so lateral surface, this one, this is the medial surface, and we have a posterior surface here. We have three borders here. The lower end has three borders. It has an anterior, posterior, and inferior border. This is the anterior border, this is the inferior border, and here we have the posterior border. Clear? So the lateral end, dobara, the lower end of the fibula forms a bony prominence laterally, that is known as the lateral malleolus. It has a lateral surface, it has a medial surface, and it has a posterior surface. It has three borders: anterior border, inferior border, and here we have a posterior border. When we look at the lateral surface is smooth. Here it is smooth. Okay, so lateral surface smooth है, non-articular है और convex है, and it forms a prominent bony, subcutaneous bony prominence that is known as the lateral malleolus. The medial surface presents a triangular articular facet in the upper part, that is here, and the apex is directed downwards, and in the apex we have a depression that is known as the malleolar fossa. This malleolar fossa is non-articular. The third surface we talked about was the posterior surface. The posterior surface is broken here, but on the posterior surface we have a vertical groove here. We have a vertical groove. This vertical groove is bounded laterally by a sharp margin. Okay, now the borders, this anterior border, the anterior border is rounded and is continuous with the inferior margin. It corresponds to the anterior margin of this triangular facet का भी anterior margin बनाता है. The inferior margin is continuous with the anterior margin and presents a notch here. Inferior margin पे हमारे पास एक notch होता है. The posterior margin is indistinct and forms the medial margin of the posterior surface. इतना सब याद करने की ज़रूरत नहीं है, मोटा मोटा याद रखना है आप लोगों को कि इस पोर्शन की सर्फेसिस तीन, लेटरल, मीडियल, लेटरल सरफेस, मीडियल सरफेस और पोस्टीरियर सरफेस. बॉर्डर्स तीन, एंटीरियर, इंफीरियर बॉर्डर और ये हमारा एंटीरियर, इंफीरियर और हमारा पोस्टीरियर बॉर्डर. ठीक है, खत्म. मीडियल सरफेस पे आर्टिकुलर फेसेट है, नीचे एक मेल्युलर फोसा है. ये आर्टिकुलर है, ये नॉन आर्टिकुलर है. लेटरल सरफेस जो है वो हमारी सबक्यूटेनियस प्रोमिनेंस बनाती है, जो कि हमारा लेटरल मेल्युलस कहलाता है. ठीक है, इसके बाद लोअर सरफेस पे हमारे पास अटैचमेंट क्या होती है. मीडियली, ये जो मीडियल पार्ट है, मीडियली अगर हम देखेंगे, इसमें मैंने बोला ट्रायंगुलर फेसेट है और मेल्युलर फोसा है. ठीक है, जो अपर पार्ट ऑफ द मेल्युलर फोसा है हेयर, on the upper part of the malleolar fossa, you have attachment of the posterior tibiofibular ligament. Tibia or fibula ka ligament. Posterior tibiofibular ligament is attached here. Posterior part of the malleolar fossa पे you have attachment of the posterior talofibular ligament, क्योंकि नीचे talus लगेगी. ऊपर malleolar fossa के ऊपर वाले पार्ट में tibiofibular ligament, नीचे वाले पार्ट में posterior talofibular ligament. ठीक है. लेटरल सरफेस तो तुम्हारी सबक्यूटेनियस हो गई. फिर आगे की तरफ से हमारा लगता है इंटीरियर talofibular ligament. इंटीरियर सरफेस पे हमारा, इंटीरियर बॉर्डर पे हमारा इंटीरियर talofibular ligament लगता है. पोस्टीरियर सरफेस पे हमारा जो मैंने बोला ग्रूव है, ग्रूव से पास होता है टेंडन ऑफ पेरोनियस लॉन्गस एंड पेरोनियस ब्रेविस. पेरोनियस लॉन्गस एंड पेरोनियस ब्रेविस मसल. ठीक है. इंफीरियरली हमारे पास इंफीरियर बॉर्डर पे वी हैव अ नॉच. जो मैंने बोला, ये नॉच जो है इस पे अटैचमेंट होती है हमारा कैल्केनियोफिब्यूलर लिगामेंट की. कैल्केनियोफिब्यूलर लिगामेंट की. नाउ coming to the shaft of this fibula, the shaft of the fibula has 3 borders and 3 surfaces. Talking about the borders first, we have an anterior border, we have an interosseous border, and we have a posterior border. So, first of all, let's see the anterior border. The anterior border begins here. This one is the anterior, this border is the anterior border. When we look at this border starts from the lower part of the anterior aspect of the head. It runs vertically downwards. Here, it's running vertically downwards, and then it divides here into 2 parts. It splits here, and it encloses this triangular space that is subcutaneous. Okay. Now, then another border is this border. This border is the medial border or the interosseous border. It runs parallel to this border. Opposite the lower fourth of the bone, it bifurcates into 2 parts, and it encloses the triangular area about the medial facet. Okay. Then we have the posterior border. This one. The posterior border is rounded. As you can see here, this is the posterior border. It is rounded. It is less distinct. It begins from the lower part of the posterior aspect of the head, here, from the posterior aspect of the head, and descends downwards. And then it becomes continuous with the medial margin of the groove that is present here. 3 surfaces that are present in this bone are, so this bone is like this, as you can see. Okay. So the 3 surfaces that are present are the anterior surface, this one, the anterior surface, also known as the medial surface, that lies between the anterior and the interosseous border. It forms a narrow surface, being narrower above when you look at it like this than below. Opposite the upper third of this surface, there is a salient ridge. We have a posterior surface. The posterior surface is also known as the flexor surface. It lies between this anterior border here and the posterior border. A prominent vertical ridge known as the medial crest descends downwards on the surface. The medial crest is only present opposite the middle of the bone and is usually absent on the upper and the lower part. We saw that it has 3 borders and 3 surfaces. The surfaces are the surface, that is the anterior surface or the medial surface, the lateral surface or the peroneal surface, and the posterior surface. Okay. Now, talking about the attachments on these surface, first of all, let's talk about the attachment on the anterior surface or the medial surface. When we look at this surface, we divide it into 4 parts: 1/4, 1/4, 1/4, and 1/4. Okay. Now, here we see we have attachment of 2 muscles here. Okay, 3 muscles rather. First of all, in the upper 1/4, whole of the upper 1/4 here gives attachment to the extensor digitorum longus muscle. Okay. Then the middle 1/4 is divided into two parts, anterior part and a posterior part by a ridge. The anterior half of the middle 2/4 is also, we have attachment of the extensor digitorum longus muscle. So the anterior surface of this bone is divided into four parts. The upper 1/4 and the anterior part of the middle 2/4 gives attachment to the extensor digitorum longus muscle. The posterior half of this middle 2/4 gives attachment to the extensor hallucis longus muscle, whereas the lower part of the surface lower 1/4 gives attachment to the muscle that is the peroneus tertius. ठीक है. So anterior surface पे, या जिसको medial surface भी कहते हैं, जो हमारे दो borders के बीच में आती है, यहाँ पे anterior border के बीच में और इस border के बीच में, इनके हमने चार parts में divide किया, 1/4, 1/4, 1/4 and 1/4. Upper 1/4, whole of the upper 1/4, middle 2/4 जो है, इसको हमने दो parts में divide किया, anterior और posterior. Anterior part, whole of this and the anterior part gives attachment to the extensor digitorum longus, whereas the posterior part of the middle 2/4 gives attachment to the extensor hallucis longus, and lower 1/4 gives attachment to the peroneus tertius muscle. Talking about this surface, that is the lateral surface that lies between the anterior and the surrounded border, that is the posterior border. This surface is divided into three parts. Okay, 1, 2 and 3 parts. The upper part, 1/3, gives attachment to the peroneus longus muscle. The middle part here again is divided into anterior part and a posterior part. So the peroneus longus takes origin from the upper 1/3, and the posterior half of the middle 1/3 is peroneus longus. Peroneus brevis is attached to the lower 1/3 here, and the anterior half of the middle 1/3. Okay. So to revise it again, we said that the medial surface or the anterior surface here, the anterior surface or the medial surface has, here you can see, so this anterior or the medial surface is divided into four parts. We have 1/4, 1/4, 1/4 and 1/4. The whole of the upper 1/4, the middle 1/4 is middle 2/4 is divided by a ridge into anterior and a posterior part. Then we have the lower down. Upper part and the anterior part of the middle 2/4 gives origin to the extensor digitorum longus. Extensor hallucis longus arises from the posterior 2/4. The lower down we have the peroneus tertius. On the lateral surface is divided into three parts: upper 1/3, middle and lower 1/3. So the middle 1/3 here again is divided into two parts, anterior and a posterior part. So peroneus longus is attached to the upper 1/3 and the posterior half of the middle 1/3, whereas peroneus brevis is attached to the lower 1/3. Okay. Now the posterior surface. When we look at this, that is the posterior surface here. The posterior surface lies between the medial and the posterior border. The upper 2/3 here is divided into medial and lateral area by a median crest. यहाँ पे भी हम तीन पार्ट्स में इसको डिवाइड करते हैं पोस्टीरियर सरफेस को. जो अपर 1/3 ऑफ द पोस्टीरियर सरफेस है, दैट इज divided by medial crest into medial and a lateral area. Okay. Now, fascia covering the tibialis posterior is attached. What is attached to the medial crest? The fascia covering the tibialis posterior is attached here. Lower part of the posterior surface presents a rough triangular area. The medial area gives attachment to the tibialis posterior. The posterior surface lies between the medial and the posterior border. Its upper 2/3 is divided by a median into median and lateral parts by a median crest, which I have said. The lower part of the posterior surface here presents a triangular rough area. The anterior margin, the intermediate area, and the posterior margin of this area gives attachment to the anterior tibiofibular, the interosseous tibiofibular, and the posterior tibiofibular ligaments. Here, the medial area, that is the area between the medial crest and the medial border, gives origin to the tibialis posterior muscle. The upper 1/4 of the lateral area here gives origin to the soleus muscle. Lower 3/4 of the lateral area gives origin to the flexor hallucis longus muscle. Peroneal artery descends in relation to the median crest. Nutrient artery, that is a branch of the peroneal artery, enters the nutrient foramen, which is present just above the middle of the posterior surface. Nutrient canal is directed downwards, and therefore the upper end of fibula is the growing end of the fibula. Talking about some of the clinical importance of this fibula, fibula is a common source of bone grafting because weight transmission इससे होता नहीं है, ठीक है? We have seen that the head of the fibula, or we can say near the neck of the fibula, if there is this common peroneal nerve passes through it. So if there is a damage to the neck of the fibula, the common peroneal nerve will be paralyzed. Both tibia and fibula are sites of stress fractures. So this finishes your fibula.